omukyala bw'oba olubuto normally omwana yalina okukulembera ekisanyi ekibeera wa mabega tukitegedde naye ate mulimu bw'ojja ng'ekisanyi kyekikoze eki kyekikulembedde.
Complications that can develop within mothers who have preeclampsia, they could be attributed to high blood pressure or to the end organ damage that happens in the placenta, in the brain, in the liver, in the kidneys. So these complications include cerebrovascular accidents in the mother that can progress to maternal death. Then we talked about pulmonary edema, which can greatly compromise the respiratory system. Mother will end up in the ICU and the sequelae that is associated with that. Then we could have acute liver and renal failure, which are also common problems that we see. These are complications that come when we manage conservatively when we are not supposed to. Then to the baby, the compromised exchange that happens at the placenta could lead to intrauterine growth restriction, intrauterine fetal death. Then the shallow placentation can also lead to abruptio placenta. It can also lead to premature rupture of membranes. It can also lead to preterm labor. So those are some of the complications that we see in mothers who present with preeclampsia. For prevention of preeclampsia, we looked at the risk factors. You've had this mother who has no preeclampsia at all and they have come for antenatal. So you've assessed, and in your assessment, this mother is at risk of getting preeclampsia. So far, the preventive modalities that we have is giving these mothers aspirin, which begins at about 11 weeks, and preferably it should be instituted before 16 weeks of the pregnancy. And the dose of aspirin ranges from 75 milligrams to 150, depending on the severity of the risk the mother is at. In addition to the aspirin, these mothers can be given calcium as a supplement in a dose of 1.8 to 2 grams. And of course, we also advise these mothers, because one of the risk factors we saw is a BMI that's more than 30. So we advise on diet during pregnancy to avoid excessive weight gain. In Kawempe, for example, preeclampsia, eclampsia is the leading cause of maternal mortality. You have done antenatal with this patient, you've diagnosed preeclampsia. We are saying let's do early diagnosis and timely intervention. If a mother presents to you with preeclampsia with severe features, admit and deliver this mother timely. Let's not delay intervention. Let's not prolong the pregnancy for the sake of the baby at the expense of the mother's life. Together, we can reduce maternal mortality.